Good day everyone, my name is Grisel Tavis Blinka, and for today's video I'm going to discuss about health illness continuum. But before that, we must go first to our learning objectives. At the end of this video, the learner will be able to describe the concept of health illness continuum. Know the importance of health illness continuum. Dr. John W. Travis developed the illness-wellness continuum in 1972. He observed that doctors and nurses usually treat illnesses, disabilities, and symptoms which bring a patient to the neutral zone. However, Dr. Travis did not believe the neutral zone should be the end goal. Instead, he thought wellness is a process and that nurses and doctors should educate and help their patients move further down the continuum towards high-level wellness. According to Dr. Travis, this could be done through awareness, education, and growth. A health continuum, also called an illness-wellness continuum, is a visual tool that can be used to help people make healthy choices in their lives. It describes how well-being is more than simply an absence of illness, but also incorporates the individual's mental and emotional health. A helpful tool in educating patients in the health continuum, also called the illness-wellness continuum. A health continuum definition is not complete without an image of the continuum shown here. The diagram shows a connection between the treatment and wellness paradigms which meet in the middle at the neutral point. As you can see, it composed of two arrows pointing in opposite direction and joined at a neutral point. The stages on the health continuum, moving from the left to the right, are premature death, disability, symptoms, signs, neutral point, awareness, education, growth, and high-level wellness. According to this theory, extreme levels of illness or death due to diseases are on opposite sides of the continuum. Next to them, closer to the center, are the levels of good health and illnesses, and in the very center, there is a neutral zone. The core of this model is individuals' ability to move towards better health and well-being whenever they don't have visible illnesses. It is essential, however, to work on one's mental health and awareness, educate oneself, and stimulate self-growth. The complete absence of any complaints is a high level of wellness, and patients with chronic diseases can also achieve this level of health if their ailments are controlled and people indicate themselves as healthy. At the same time, a person without any psychological manifestation of the illness may relate to the negative part of the spectrum if he or she feels depressed, stressed, and unhappy. So in health illness continuum, the most important is the direction, is the individual facing on the pathway. If towards high level of health, a person has genuinely optimistic or positive outlook despite his or her health. If towards premature death, a person has genuinely pessimistic or negative outlook about his or her health status. If we compare treatment model with a wellness model, if treatment model is used, an individual can move right only to the neutral point. Example of this, a hypertensive client who only takes his medications without making any other lifestyle changes. If wellness model is used, it passes to the neutral point. Example of this, a hypertensive client who only takes his medications but stops smoking, loses weight, starts an exercise program. Nurses need to understand and accept the concept of the continuum to improve the patient's condition. A nurse can affect the patient's health and treatment by using such practical means as medication and procedures and by explaining to them the importance of a positive approach to their health. For example, a person who was first diagnosed with diabetes is in the phase of the illnesses in the continuum. However, diet, healthy lifestyle, and medications will make his or her diagnosis almost unnoticeable. Nurses should explain this factor to the patients since a positive and correct approach to their health helps to improve it. In general, nurses can use a wide range of resources to improve patient health. Firstly, these are medical tools that help treat diseases or recover from operations. These measures may include medication, exercise, massage, and other treatments. Therefore, the health illness continuum is a concept that explains changes in a person's well being over time and the possibility of influencing it. Nurses need to understand and use this concept to ensure the best care for patients in the hospital and after discharge. This understanding helps people to live a happy life despite their chronic diseases, and it pushes to them to realize the importance of their health. As health professionals and educators, nurses have a responsibility to not only treat their patients but also educate them. The illness wellness continuum can be a part of the education. In addition, the health continuum is a tool to show patients how prevention and lifestyle choices can move them out of the treatment paradigm, past the neutral point, and into the wellness paradigm towards a full, healthy life. Factors influencing health are physiological factors and genetic factors. Physiological changes, example, pregnancy and certain genetic factors cause increased susceptibility to illness. Age. As age increases, there is increased susceptibility to certain illness. Environment. The physical environment in which a person works or lives can increase the likelihood of certain illness. Lifestyle. Factors. Lifestyle practices, habits, activities, behaviors have a positive or negative effect on health. Factors affecting health and illness. Physical dimension. Physical dimension, the state of physical health implies the notion of perfect functioning of the body. It conceptualizes health biological as a state in which every cell and organ is functioning at optimum capacity and in perfect harmony with the rest of the body. It includes genetic makeup, developmental level, race, and sex, all parts of individuals which strongly influence health status and health practices. Mental or intellectual dimension. Mental intellectual dimension. Mental health has been defined as a state of balance between the individual and the surrounding world, a state of harmony between oneself, that of other people, and that of the other environment. Sociocultural dimension. Sociocultural dimension, it is defined as quality and quantity of an individual interpersonal lives and the extent of involvement with the community. The social dimension of health includes the level of social skills one possesses, social functioning and the ability to set oneself as a member of a larger society. It includes individual economic level, educational status, lifestyle, family, and culture. These are all which influence on the health and illness of people. Individual dimension. Individual dimension, it has many influences on health and illness. Housing, sanitation, climate, and pollution of air, food, and water are aspects of the environment which cause illness. Emotional dimension. Emotional dimension, it expresses that how the mind and body interact to affect body function and to respond to body. Emotions also influences health. Long-term stress affects the body system and anxiety affects health habits. Calm acceptance and relaxation can actually change the body responses to illness. Historically, mental and emotional health dimensions were considered same, but mental health can be seen as knowing or cognition, and emotional relates health to feeling. Spiritual dimension. Spiritual and religious beliefs and values are the important component of how a person behaves in the health and illness. It is important that nurse respects these values and understand their importance to the individual's spirituality. Practical skills as a dimension. Practical skills as a dimension, when work is fully adapted to human goals, capacities, and limitations, it often plays a role in promoting both physical and mental health. Goal achievements and self-realization in work is a source of satisfaction and enhanced self-esteem. So the advantages of health illness continuum is most effective when used to compare a client's present level of health with the client's own previous level of health. Subsequently, it is useful as the nurse helps the client set goals to attain a future level of health. The disadvantages of health illness continuum. It is not always easy to describe a client's level of health in terms of one point between two extremes. For example, a man with a broken leg but who has adapted to limited mobility is more or less healthy than a physical healthy man, experiencing severe depression after the death of a spouse. The health illness continuum has been viewed as promoting preventive treatment, which improves well being before an individual presents with signs or symptoms of illness, as well as educating people to be aware of and avoid risk factors in order to protect against pathology and premature death.